I'm Savannah and I'm going to show you how to do an abdominal examination. So what you want to start off to do is observe the abdominal region. Is it flat? Is it distended in anywhere? Or is it enlarged? Are there distinct protrusions that could be linked to underlying organomegaly, which means an enlarged organ? You also want to watch the patient's movement. If they're squirming around on the table and trying to find a comfortable position, it could be likely that they have kidney stones. Or if they're lying very still so they don't have any pain, that could be linked to appendicitis. Before you start to touch the patient, you're going to want to put gloves on for standard safety precautions. So now we're going to auscultate the abdomen, and what we're going to be doing is trying to listen for bowel sounds at first. And regular bowel sounds occur frequently, like about every 2 to 5 seconds, and those are mostly irrelevant. But bowel sounds that we have to be careful about is like the inflammatory processes of the serosa, which is the surfaces that cover the abdominal organs. They will cause the abdomen to be quiet. So if you have a completely quiet abdomen, that's not a good thing either. If you have inflammation of the insides of the intestine, it will cause hyperactive bowel sounds. And if you have an intestinal obstruction, frequent sounds of rushes will be heard. So following listening to the abdominal region for the bowel sounds, you want to use the diaphragm of the stethoscope to check for the renal artery bruits, a high-pitched sound caused by turbulous blood flow through a vessel narrowed by atherosclerosis. And right where you're going to find this is a few centimeters above the umbilicus or the belly button, and you're going to press firmly and listen. Now for abdominal percussion, you're going to place the left hand firmly against the abdominal wall such that only your middle finger is resting on the skin. You're going to strike the distal interphalangeal joint of your left middle finger 2 to 3 times with the tip of your right middle finger. 2 basic sounds can be elicited from this. A tympanic or drum-like sound would be elicited by percussing over air-filled structures. A dull sound would be heard over solid structures or where fluid lies, like your liver or ascites. To determine the size of the liver, start below the right breast in line with the mid-clavicle. The sound should be relatively resonant, like a deep, clear, and hollow sound. And you should move your hand a few centimeters down and repeat percussing until the sound makes a duller sound. Continue until the sound changes once again back into a tympanic sound, and that should tell you the size of the liver. Changes can be very subtle, especially if the patient is more obese. And the resonant sound produced by percussion over the chest wall will be less drum-like than in intestines. When the spleen is enlarged, percuss in the left upper quadrant will produce a dull tone. To detect ascites, assessment for shifting dullness is perhaps the most reliable and reproducible. Air-filled intestines will float on any fluid present. So you're going to percuss from the belly button down laterally with ascites, and the sound will go from tympanic to dull. And you're going to mark this point on both the right and the left sides. And then what you're going to do is you're going to flip the patient and go from his whatever side he's on down towards the belly button, and then you're going to make another line where the sound goes from tympanic to dull. And with ascites, if the first line and the second line don't meet up, that means that you have a fluid-filled structure there where the intestines are lying on top of. Now for abdominal palpitation, you need to use the pads and the tips of your fingers because they're the most sensitive areas of the index, middle, and ring fingers. They are used to locate the edges of the liver and spleen as well as the deeper structures in the abdomen. You're going to apply slow, steady pressure, avoiding rapid and sharp movements. Examine each quadrant separately. You're going to start in the upper right quadrant, 10 centimeters below the rib margin in the mid-clavicular line, below the liver edge. It is easier to detect an abnormal area if you start in an area that's normal. You're going to gently push down posterior and towards the patient's head with your hand oriented roughly parallel to the rectus muscle, allowing the greatest number of fingers to be involved in the exam as you try to feel the edge of the liver. Advance your hands a few centimeters up and repeat until ultimately you're at the bottom margin of the ribs. Following this, you need to repeat the examination of the same region but push a little bit more firmly, especially if the patient has a lot of subcutaneous fat. Pushing up and in while the patient takes a deep breath may make it easier to feel the liver edge, as the downward movement of the diaphragm will bring the liver towards your hand. Make sure that you don't touch the xiphoid process and mistake it for an abdominal mass. You can also try to hook the edge of the liver with your fingers. To utilize this technique, flex the tips of your fingers on your right hand in a claw-like fashion, then push down and in to the right upper quadrant and pull upwards towards the patient's head. Place your right hand at the inferior and lateral border of the ribs, pushing down as you push up with your left hand. If the right kidney is massively enlarged, you may be able to feel it between your hands. Now examine the left upper quadrant. The normal spleen is not palpable, but when it is enlarged, it tends to grow towards the pelvis and the umbilicus. Begin palpitating near the belly button and move slowly towards the ribs. Then start 8 to 10 centimeters below the rib margin and move upwards. In this way, you will be able to feel enlargement in either direction. You can use your left hand to push in and your right hand to direct the spleen towards your left hand. If the spleen is very big, you may even be able to bounce it back and forth between your hands. Splenomegaly is probably more difficult to appreciate than hepatomegaly because the liver is bordered by the diaphragm and can't move away of the examining hand. Okay. Now we're going to try to feel for the abdominal aorta. First, push down with a single hand in the area just above the umbilicus. If you are able to identify this pulsating structure with one hand, try to estimate its size. To do this, orient your hands so that the thumbs are pointed towards the patient's head. Then push deeply and try to position them so that they are on either side of the blood vessel. Estimate the distance between the palms.